My name is Amy Yorke, and I'm one of the instructors for the Introduction to Vestibular Rehabilitation course. The Introduction to Vestibular Rehab course covers content related to the vestibular system located in the inner ear. So we cover a variety of diagnoses, including BPPV, benign paroxysmal positional vertigo, diseases that cause a hypofunction, unilateral vestibular hypofunction or bilateral vestibular hypofunction, and also diseases of the central nervous system. When you come to the course, you learn examination techniques that you can utilize in order to successfully evaluate somebody who comes to you with a report of dizziness. When patients come with that report of dizziness, that can be somewhat scary because dizziness can come from so many different things, including low blood pressure, high blood pressure, problems with blood sugar, and it becomes a symptom that if you're not familiar with, you may just choose to avoid or ignore. By coming to this course, we really intend to give you the skills and the knowledge to help those patients that come see you with a report of dizziness. So you can say, well, is this coming from the vestibular system or is it not coming from the vestibular system? Specifically, you learn examination techniques, including the Dix-Hallpike position and the roll test to be able to successfully diagnose somebody with BPPV, and then treatment techniques to be able to help them if they do have BPPV. In addition to those positioning techniques, you'll also learn the oculomotor exam. They say the eyes are the window to the vestibular system. And so if you are actually looking at the interaction between the inner ear and the eyes, you'll better be able to say, is this coming from the central nervous system or is it coming from the peripheral vestibular system, or maybe not the vestibular system at all? You also learn then treatment techniques. So if I recognize that this is coming from the vestibular system, what are some treatment techniques that I could learn, that I will learn in order to best help somebody with vestibular? You're going to learn treatment techniques so when your patient says, when I move my head, I get dizzy, we utilize habituation for that. If your patient says to you, when I move my head, things seem to be blurry, you're going to learn gaze stability exercises for that. If your patient has balance dysfunction, you're going to have some hopefully new techniques to be able to implement into your practice. When people come to the Introduction to Vestibular Rehab course, they often come with just a little bit of anxiety and concern because perhaps they graduated a long time ago and they never got vestibular rehab in school, or they just graduated last year and they got it, but they never really understood it. One of the high points of teaching this course is that I get to see the students really grow and be able to apply the knowledge that they've learned in just this 2-day course, from really understanding of why would I do this test, what does it mean, and then how would I best help a patient for. I enjoy teaching this course because I get to see therapists start to put the dots together, improve their clinical decision making, and be able to help those patients that they see report dizziness. I hope to see you soon at an Introduction to Vestibular Rehab course.